Hi, I'm Dr. Ahmed Sen Pathan. You are watching my YouTube channel Surgitalks. Today I am going to tell you about the breast lump. What is breast lump? A swelling or a mass in a female's breast causes the breast lump. Should every breast lump is a cancer? The answer is no. Every breast lump is not a cancer. We divide the breast lump into two main groups. One is the non-cancerous, or in medical term we call it as a benign conditions. And other one is the malignant or the cancerous condition, that is called the breast cancer. In benign or non-cancerous conditions, there are many conditions which can cause the breast lump. First of all, we start with the commonest condition, that is the fibroadenoma of the breast. It occurs in the young females from 15 to 30 years of age. It's a simple swelling present in the breast and mobile and move with the fingers, or we call it as a breast mouse. Another condition that is the lipoma. It is a fatty condition present in the breast. And the third one is the breast cyst, which contains fluids. These three conditions are the painless breast lumps. The other condition, non-cancerous or benign condition, which can cause the pain, that start with the fat necrosis. It occurs mostly in the females having children or feeding mother. Sometimes the head of the baby forcefully strike with the breast of the mother, and it causes the fat necrosis. Second one is the breast abscess. It can cause the inflammation or formation of the pus in the breast, and we call it as a breast abscess. Fibrocystic disease. It is the most common condition in the middle-aged women, and it is related with the menstrual cycle, and the pain become worsened during the menstrual cycle. And the other group, that is the breast lump with the nipple discharge. There are two conditions. One is the galactocele. That is again in feeding mothers, the discharge of the milk from the nipples along with the swelling. And other one is the ductectasia, that is the dilatation of the ducts of the breast, and its discharge will be green or black in color. Other one is the cancer or the malignant condition, or we can say it's the breast cancer. There are many groups or many types of breast cancers are there. So first of all, before going to the doctor, the female when feel any breast in her any lump in her breast, then first of all, no need to be panic and don't think directly about the cancer. First of all, she should examine herself, see the how the breast lump size is, how the consistency is. So first I'm now telling you about the consistency or the differentiate point between the non-cancerous and cancerous conditions. In non-cancerous condition, the lump is soft in consistency with a regular margin and mobile. And other than the painful conditions, most of the time the breast lumps are painless. While when we are talking about the cancerous lump in the breast, they are hard in consistency, fixed with the overlying skin or the underlying tissues, with irregular margins and dimpling of the skin over on the breast, and the discoloration of the skin also there in the cancerous conditions. So any of the signs or symptoms can match with the any of these symptoms. So the female should consult with the doctor, get her examined, and reach the diagnosis. The doctor will do the examine. We will call it as a triple assessment. The first one is the history and clinical examination. Doctor examine, get the history from the patient, duration of the illness, when it starts, either it is a painful or painless, or is there any other lump in the breast or any other part of the body or not, and family history. All the history will be taken by the doctor, and the examination will also be performed by the consultant surgeon or the concerned doctor. After the clinical history and examination, doctor will advise the radiological investigations. Start with the ultrasound and mammogram, and if needed, then the CT scan or MRI can be proceeded. Most of the time mammogram is contraindicated below the age of 40 years, and after 40 years of the age, mammogram can be advised, or in conditions where doctors suspect any cancer or malignant condition, then mammogram can be advised. And the third one is the diagnosis of tissue, that is we done by the needle core biopsy. We take out the some sample of the tissues of that lump and send for histopathology and biopsy to confirm what type of tissue it is, either it is a benign or malignant, or if it is the malignant or cancerous, then what type of cancer cells it containing, so that accordingly the treatment can be proceeded. Now the final term is the management. Most of the time the non-cancerous or benign conditions can be treated conservatively according to the sign and symptoms. If there is no any pain, then reassurance of the and observation will be carried out. And if the fibroadenoma size is larger one, then it can be excised, or if it is smaller one, then can be reassured, or it may get regress spontaneously. And if there is a painful condition, then anti-inflammatory or painkiller can be advised, and sometimes antibiotics can be given. And other one, if there is a abscess, then and it's a large one, then it has to be discharge, or it has to be carried out by the incision and drainage. We can drainage out the pus and then treat accordingly. In fibrocystic disease, sometimes we do the prescribe special medication for that diseases, especially these are specified for the fibrocystic disease. And finally, the term is the malignant or cancer of the breast. It should be removed surgically, and after that chemotherapy, radiotherapy and the hormonal therapy will be advised. So whenever any female feel lump, so no need to be worried immediately, or don't be panic. Examine herself, consult with the doctor, and first of all confirm the diagnosis, and then accordingly get treated. Thank you very much for watching my channel, and do like and subscribe and share with your family and friends.